Hi everyone, and welcome to OurVentura TV. I'm your host, Sandra Siepak. Our guest today is Dr. Lanyard Dial. He is the President, CEO, and Medical Director of Livingston Memorial Visiting Nurse Association and Hospice Care. Thank you for joining us, Dr. Dial.
Thank you very much for having me.
Good. Let's talk about Livingston Memorial and all the great things you do here in Ventura County for some of the folks here.
We've been created back in 1947. Olivia Hathaway was a nurse, and she felt it was appropriate and important to be able to provide care in patients' homes. From 1947 till around 1980, we were known as the Ventura Visiting Nurses. But in 1980, we formed an affiliation with the Livingston Memorial Foundation, which had money that they were interested in helping in this community and healthcare needs. And they made a commitment to Livingston at that time to become Livingston Memorial Visiting Nurse Association. Then in 1986, we created the first medical hospice program in Ventura County, adding on to, at that point, our home care services. Nice. And then in the 90s, we created personal care services. So we do all three of home health care, hospice care, and personal care services. We've also created a palliative care program that allows patients who aren't terminally ill, but have serious medical illness to come into care and get specialized care by a team members of our hospice team in addition to their ongoing home health care.
Right. And that list includes home health care, hospice care, bereavement support classes, nursing, and personal care, all under one umbrella.
All under one umbrella.
Right.
And in 2017, we were able to merge with Camarillo Hospice. Camarillo Hospice, which had been one of the premier volunteer hospices in our community, did even more bereavement services than Livingston had done. So now under the one umbrella of Livingston, with those bereavement services, we have even a broader range, including one-on-one individual counseling services available for end-of-life care issues.
I know that Livingston is a real team effort, a real team approach to all that you do, for all the care that you give so many people, of all ages, by the way. I will add that too. And with this merger with the hospice that you're mentioning, I think that's really, really good.
Yes.
It says a lot.
Absolutely. And the Camarillo Hospice breadth of programs also, like Livingston's, included all age groups. So we provide hospice care to children and now bereavement services, one-on-one counseling services for children. So we offer a very broad range to all citizens of Ventura County. And the key, we're the only nonprofit doing that in this community. So we do that irregardless of the person's financial ability to pay. So the vast majority of Medicaid patients are under our care in this community, and the vast majority of patients who have no payer source, who are indigent in the community.
And that's quite an undertaking to bring people like that who find they're kind of stuck. They don't know where to turn financially. Right. This gives them some hope.
Well, we're a unique piece of the healthcare market. We do care in the home. And so patients who go into the hospital and need follow-up care, that's where we come in. And if you go into the hospital and you don't have financial resources and you come home, we're there to make sure your care continues in the home.
That's great to know. That's good. I think one of the things that can be very challenging for many people in home care is caring for somebody in hospice care, having a family member go through that situation. Caregivers really put a lot of effort into that, and sometimes it takes its toll.
Absolutely. A lot of the times it's a family member who's typically also an older person, potentially, and so we're there to make sure that family member gets the support they need to help take care of their loved one. Dying at home, I think, is a wonderful thing, and I think it's a thing that's very comforting to know that you don't have to be in a hospital setting away from your family, where you can be in your own bed, in your own environment, to take your last breaths. But it does take a person there with you to be sure that you get the care you need. And we're there to make sure that person gets the support they need.
And like you said, that's very comforting.
Very comforting. Hospice is all about not just the patient, but the family and caregivers around that person.
Let's mention the website real quick, if you can, for our viewers.
Sure. You can do lmvna.org, Livingston Memorial Visiting nurseassociation.org.
Okay.
You can do livingston.org and you will still get to us.
Good.
You can go through us right now still through CamrioHospice.org because that links into Livingston. You can get to Camrio Hospice through livingston.org.
Oh, good. Okay, because I know there's going to be people out there who want to know how to reach you
Absolutely.
and get more information.
Yeah, and we have a centralized phone number. That's 805-642-0239. That will
Good.
get you into all Livingston services.
I know many of these services you had mentioned are for all ages, which is good to know. You don't just service seniors or adults.
All
There are
ages.
children as well.
We have children who are part of our both home health care and our hospice care and
Okay.
our palliative care and our bereavement services. So we take care of all ages. Virtually every payer source will pay for the care we provide, so there's really little out of pocket for the patient. If you have an insurance that has a deductible, that might be there. And again, if you have no resources, we're still there to take care of you.
Right, and that's such a big help. Big
Absolutely.
help for many, many families
Yeah.
who will not know where to turn. So this will give them something to look into. I know that you have a very highly trained staff. You have not only nurses, but you've got physical therapy, you know, many, many aides that help, and volunteers.
Absolutely.
So let's talk about some of the people that make up Livingston and what they do.
Sure. So across each of the departments, be
Yes.
it home health or hospice or caregivers, we have trained professional staff.
Okay.
Licensed nurses make up the bulk of what is in home health or hospice care.
Okay.
Physical, occupational, speech therapy services, all the rehabilitation services for post-stroke victims or elderly people who have trouble with their frailty. We have the therapy services that can come into the home. We have social workers who can help you process information about resources in the community, can help you seek and find resources in the community should you need a meals program, should you be looking at being placed in a residential care facility by your family, if that's an option people are looking at. We have dietitians to help with nutritional needs. We have specialty nurses in diabetes. We have specialty nurses in wound care. All of that is in our home health area. Hospice also adds chaplains support, and that is part of our hospice program as well as our palliative care program, because spiritual needs at the end of life are really crucial. We have home health aides across both programs because when you're home and frail, having an ongoing bath or hair done or something, keeping your personal care up is really important. And should you need to have someone live with you for a time frame, 2, 3, 4 hours a day, 8 hours a day, 24 hours a day, we have personal caregivers through our Livingston caregivers who can come in and do that with you.
And that's so reassuring to family members to have that person there for their loved one.
And you know, finding a personal caregiver is a little hard in the community.
Very difficult, yes.
Because there aren't a lot of them, and the resource is relatively expensive to have that kind of care. And so we offer the ability to have that personalized, and we match a caregiver with you, and we support that caregiver with you. So if that caregiver gets ill, we'll have another caregiver come in. We ensure that if you work with Livingston for the needs of a caregiver, we will be there to take care of you whenever you need that. And that was crucial as we came through the late 2017 Thomas Fire, because we had a lot of families who depended upon our services to be there for them even during that time. And so people who needed and wanted caregivers into their homes prior to the fire and then were worried what was going to happen during that disaster, we were able to go there and our caregivers were still in those homes.
So everybody was still working.
Everybody was still working. In fact, working overtime and double time.
Is that right? Wow.
Despite the fact that 30 to 40 of our staff were evacuated from their homes. Despite the fact it was hard to get into some neighborhoods and get around in the community. And despite all the electrical outages that occurred, we were still there providing them home health, hospice, and caregiver services.
That's very good. One of the things I want to talk to you about is funding to run this organization. As a nonprofit, funding is crucial.
Funding's crucial. Obviously, like all the nonprofit healthcare services, like our local hospitals, we can bill and collect from payers, Medicare, Medicaid, private insurances. But many of those payers are negotiated rates for what they'll do. And in particular, Medicaid has a flat fixed rate that the state utilizes. And that rate doesn't cover all of our costs. So in order to provide for that population of patients, we need to raise funds to do that. In addition, we see Livingston as a community resource. So we're out doing classes in education. We're out in educational ways for diabetes, for end-of-life care. We're out in the community with health fairs. We're ensuring as best as we can that our resources are available to the community outside of the Livingston walls. So we provide counseling and bereavement services in the school systems. We provided during the Thomas Fire bereavement for the 2 middle schools that were on the avenue and right up the Day Road Street here in order for them to be able, the kids, as they came back to school, to have services available to them for the losses that they saw and experienced. So we provide all of that, and we need the community support to do those extra things because there's no reimbursement for those kinds of services.
So do you do a lot of fundraising? Do you
a lot of fundraising.
Events throughout the year?
We have events throughout the year. We solicit grant donations from various granting agencies, and we raise close to $1.5 million a year to offset the cost for those things.
Which will contribute to doing so many other services that may not be paid for.
Absolutely.
And that's something that is definitely needed.
And that's unique. Again, Livingston's the only resource for those kind of services in this community.
Another valuable thing here with Livingston is your volunteer group. Volunteers make up quite a bit of what you do. And
absolutely.
So let's talk about that too. If you would like to volunteer or get involved.
So we do volunteer training.
Okay.
We have classes doing volunteer training both at Camarillo Hospice and at Livingston's main site.
Good.
Under both of those, we have a program that lasts 6 to 8 weeks that makes sure you're comfortable in the health field with volunteering. But some of those volunteers will work in the office also and help us do some of our filing, some of our mailings. But most of our volunteers are out into patients' homes helping them deal with and be supported by their understanding of what their care needs are. So our volunteers will be there to help, and we try to pair up appropriate volunteers with appropriate patients. Patients who served in World War II, and we have volunteers who served in World War II, so they can share and deal with information. With the addition of Camarillo Hospice, we brought over a large group because that was a large component of Camarillo Hospice. So we merged the 2 volunteer pieces. And every year we put on a large volunteer welcoming party just to honor them. And so we had both groups together this year for the first time.
How nice.
Very nice.
That's really good. Healthcare landscape is really changing these days. It's certainly different than it was in 1947. So
absolutely.
I think now, today, with the changing landscape, as I mentioned, of healthcare, how do you see the future for Livingston?
Well, the changes are enormous. There's 2 major thrusts, and that is movement towards home care, hospice and palliative care, with the understanding that hospitalization is a difficult place, an area in which people need to go to get the acute care they need, but getting them home soon so they can get the care they need in the community.
Great.
That will increase. The baby boomers turned 65 in 2010. In 2020, they will turn 75. The largest beginning wave of numbers of seniors who need services continues to grow.
Well, I certainly think that what you're doing is so important for the community, and I wish you nothing but the best for the future of Livingston Memorial. You're doing a wonderful job.
And thank you for this opportunity to help our community better understand it.
Thank you very much, Dr. Lanyard Dial.
You're welcome.
And thank all of you for joining us today on OurVentura TV. I look forward to seeing you next time. Bye, everyone.